Narration: Women's Prenatal Plus DHA is a combination of multivitamins, minerals, and fatty acids that is used to treat or prevent vitamin deficiency before, during, and after pregnancy. These essential nutrients are important for the overall health of the body. Additionally, this product contains iron and folic acid, which is crucial for women of childbearing age to prevent infant spinal cord defects in the developing baby. It is recommended to take this medication as directed by your healthcare provider, and it is best to take it with food to help with absorption. Remember to maintain adequate levels of folic acid either through your diet or supplements to ensure a healthy pregnancy. When taking Women's Prenatal Plus DHA, it is generally recommended to take it by mouth, usually once or twice daily as directed by your doctor. If you are taking the powder form, mix it in water before swallowing, and if it's the delayed release form, do not crush or chew it. This medication is best taken on an empty stomach 1 hour before or 2 hours after meals, with a full glass of water unless directed otherwise by your doctor. If stomach upset occurs, you may take it with food. It's important to avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication as it can decrease its effectiveness. Remember to not lie down for at least 10 minutes after taking it. It's also advised to take this medication regularly at the same times each day to get the most benefit from it. Always consult your doctor or pharmacist for details specific to your particular brand. Some common side effects of Women's Prenatal Plus DHA may include constipation, diarrhea, or upset stomach, but these effects are usually temporary and may go away as your body gets used to the medication. If they persist or worsen, it's important to notify your doctor or pharmacist. Iron in the medication may cause your stools to turn black, which is not harmful. Your doctor has prescribed this medication because the benefits outweigh the risks of potential side effects, and many people using this medication do not experience serious side effects. However, if you experience easy bleeding or bruising, it's important to inform your doctor immediately. Serious allergic reactions to this drug are rare, but seek medical help right away if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, it's essential to contact your doctor or pharmacist. As for the best time to take this medication, it's usually recommended to take it with a meal to help reduce the risk of stomach upset. The daily dosage and optimal timing may vary, so it's important to follow your doctor's instructions carefully. It's important to keep Women's Prenatal Plus DHA out of reach of children, as accidental overdose can be fatal. If overdose does occur, it's important to seek medical help immediately or call a poison control center. Before taking Women's Prenatal Plus DHA, it's important to let your doctor or pharmacist know if you have any allergies to the ingredients, fish, or soy/peanut, as this product may contain inactive ingredients that can cause allergic reactions or other problems. Make sure to discuss your medical history, including iron overload disorder, alcohol use/abuse, liver problems, stomach/intestinal problems, vitamin B12 deficiency, and bleeding disorders with your doctor or pharmacist before taking this medication. It's also important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products, before having surgery. When used as directed, Women's Prenatal Plus DHA is safe to take during pregnancy. However, if you are breastfeeding, it's best to consult your doctor before taking this medication. As for the daily dosage and optimal timing, it's best to follow the directions provided by your healthcare professional. It's important to be aware of potential drug interactions when taking Women's Prenatal Plus DHA. This can affect how your medications work and increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this medication include chloramphenicol, certain anti-seizure drugs, such as phenytoin, methyldopa. Additionally, this product can decrease the absorption of other drugs such as bisphosphonates, including alendronate, levodopa, penicillamine, quinolone antibiotics, such as ciprofloxacin, levofloxacin, thyroid medications, such as levothyroxine, and tetracycline antibiotics, such as doxycycline, minocycline. It's recommended to separate your doses of these medications as far as possible from your doses of Women's Prenatal Plus DHA. It's best to ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. Remember, always consult with your healthcare provider before making any changes to your medication regimen. If someone has taken too much of Women's Prenatal Plus DHA and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate help. You can call 911 or your local poison control center at 1-800-222-1222 if you're in the US. In Canada, you can call a provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. It's important to seek help right away if you suspect an overdose. It's important to remember that you should not share this medication with others. Your doctor may recommend lab or medical tests, such as a complete blood count or checking your vitamin B12 levels, while you are taking this product. It's important to keep all your medical and lab appointments and consult your doctor for more details. Some brands of prenatal vitamins also contain ingredients like calcium, zinc, iodine, or docusate. If you have questions about the ingredients in your brand, make sure to consult your doctor or pharmacist. It's also important to remember that this product is not a substitute for a proper diet. It's best to get your vitamins and minerals from healthy foods, so maintaining a well-balanced diet and following any dietary guidelines as directed by your doctor is important. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at the usual time. Don't take double the dose to make up for the missed one. Make sure to store Women's Prenatal Plus DHA at room temperature and away from light and moisture. It's important to keep it out of the bathroom and out of reach of children and pets. When it's expired or you no longer need it, make sure to properly discard it. You can ask your pharmacist or local waste disposal company for guidance on the best way to do this. And remember, never flush it down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.